and pretty surgical.
Okay.
Okay, so the first one from the CPRU. So let's see what these questions are we have for you. So again, although we're videotaping, it's just a dialogue. So we'll split this up into like different snippets that go into a video.
Okay.
So what do you do every day, you personally, to keep patients safe from Hep U's?
Well, this has been a recent project in the CPRU. We've had a couple of nurses who've been involved in projects and trying to get research involved with it also, but we have started to really focus on patients' skin before they go into procedures and take a look at where the risk areas are, where we might see bony prominences, and make sure that we protect them before they go under any kind of sedation. Communication is a big thing with documentation in Epic, and then also phone communication with the different procedure areas so that we protect them, these risk areas, and we're also communicating, please be on the lookout for these risk areas. And then following up at the end of procedures with examining these risk areas too.
So what involvement do you have in developing the process or even adhering to the process? I mean, again, individually, we'll talk about team, but
Sure.
So how do you affect the process?
So I affect the process by just being the first eyes on a patient and identifying these risk areas, making sure that all these areas are covered with Mepilex. We use Mepilex border a lot on our patients, sending them into procedures, and just communication with the people who are going to put them under sedation and position them.
Nice. So that leads into how did your unit come together around this issue to kind of reduce or keeping them safe from the Hep U's? Like, so as a unit, I know you say communication. Are there any other things that you do to kind of rally around this?
So just a lot of encouragement and feedback with each other to make sure that everyone's staying accountable with the process that we've identified. We have a couple people who kind of head this project, and they're constantly having meetings to evaluate it and then coming back to each person, and they do some audits of charts to check documentation, and if they see anybody who's been missing the Mepilex, then they'll go back and just touch base, find out why, and encourage use of it in the future.
Excellent. We always ask, what advice would you give other units, this based on your success?
Probably just to stay consistent, be strong in your value of skin protection, and especially through a procedure area, people want to move quickly. Just taking the time to slow them down so that you can actually do what you need to do to protect their skin.
So how do you work with families too? Because I know if when you're rushing or there's things that are immediate needs and they get concerned and they kind of intervene, how do you handle those situations?
Just take a minute to have everyone take a deep breath, slow down, talk about why it's important, and just kind of work everybody through it, make sure it gets done.
Awesome.
Keep it a priority.
I think that's great.
Awesome.
Okay. Have you guys seen a decrease? I'm just curious.
You know what? I'm not sure, because they might still be kind of closing this research project, so I'm not sure if they've gone back and done numbers again to see. But it seems like just in the day-to-day that we've had fewer cath patients at least come back complaining of like lower back pain and fewer redness incidents on their sacrum, and so it seems like it helps.
Fantastic. Thank you so much for your time. I really appreciate it.